Ever get that, like, chest pull that just hangs on forever? It can
Mhm.
be so annoying, right?
Yes.
Well, you're not alone. Millions of people deal with that every year, and it's called acute bronchitis.
Hmm.
And today, on the deep dive, we are going to cut through the confusion.
Yeah.
We're going right to the source. We're going to look at a really recent rapid evidence review
Right.
from American Family Physician from 2025.
Cool.
And we're going to get down to what it is, when you should actually be concerned about it, and what actually
Yeah.
helps and what doesn't, which is surprising sometimes.
Totally. And that's what I love about these rapid evidence reviews is that it's really looking at the evidence for what we should do in primary care for patients like you, so that when you go in, you're getting the best care possible based on the current evidence.
Yeah, so let's jump into the basics first. What
Mhm.
is acute bronchitis?
Okay, so the clinical definition of acute bronchitis is an acute cough
Okay.
with symptoms of a lower respiratory tract infection. So that could be things like sputum production or wheezing. But the main part is that it's in the absence of pneumonia or chronic lung disease.
Okay.
So things like COPD.
So it's more than just a cough, but it's not pneumonia.
Exactly.
Okay.
And, that sputum that I was talking about, it can be productive or non-productive, meaning you either are coughing something up or not.
Right. Okay. Yeah.
And this is actually a very common problem. It results in over 3 million outpatient visits and over 1 million ED visits annually.
Wow, that's a lot of people coughing.
Yeah, a lot of people.
Okay, so what causes acute bronchitis?
So in healthy adults, over 90% of the cases are actually caused by viruses.
No.
So these are viruses like influenza, parainfluenza, rhinovirus, adenovirus,
Combined better the
rhinovirus.
suspects.
Yeah, the common cold viruses,
Okay.
human metapneumovirus, and RSV.
Oh, yeah, RSV.
Those are kind of the main viruses that can cause this.
Okay, so it's in the same family as the common cold, just affects your lower airways.
Exactly.
So what about bacteria? We hear about people getting antibiotics for bronchitis, so bacteria must be playing a role sometimes, right?
You would think so, but actually this is where the research is really interesting
Okay.
because bacterial causes such as Mycoplasma pneumonia, Chlamydophila pneumonia, and Bordetella pertussis, which is whooping cough, are really rarely identified.
Really?
So that's something that I think people would be surprised to know is that it's actually really rare that bacteria are the cause of acute bronchitis.
Huh, that is interesting.
Yeah.
So if it's mostly viral, how do doctors actually diagnose this? Like, what are the tests they run, and when should you be thinking that your cough might be more serious than just bronchitis?
So the diagnosis of acute bronchitis is mainly made clinically so, based on your symptoms
Okay.
and the absence of another cause.
Okay.
So ruling out things like pneumonia, asthma, COPD, exacerbations, or heart failure.
So it's figuring out what it isn't as much as what it is.
Exactly. Yeah.
And how do you tell the difference between bronchitis and pneumonia?
Yeah, so that's a really important distinction. And the rapid evidence review that we're looking at actually found that pneumonia is only diagnosed in about 5% of adults who present with acute cough to primary care.
Okay.
So it's not as common as you might think, but there are some red flags that we look out for.
Okay.
So one thing that can be a sign that you might have pneumonia is an absence of cold-like symptoms, which we call corinzo,
Okay.
and along with that shortness of breath. And then also abnormal lung sounds like radals,
Okay.
which is kind of a crackling sound when your doctor is listening with their stethoscope, and then abnormal vital signs.
So if you're coughing and you have the sniffles, it's more likely bronchitis.
Yeah, that could be one indication. But again, it's important to remember this isn't a perfect rule.
Right, of course.
And when I say abnormal lung sounds and abnormal vital signs, I mean things like an elevated heart rate,
Okay.
an elevated respiratory rate, fever, things like that. And this rapid evidence review found that in healthy adults under the age of 70 who don't have these features and have a normal heart rate, respiratory rate, temperature, and a normal chest exam pneumonia is very unlikely.
Okay, that makes sense. But I imagine for older adults or people with other medical problems, it might be a little trickier.
Exactly. Yeah, you have to take those things into consideration.
So when it comes to testing for bronchitis or ruling out these other conditions, what does the evidence say are things like chest x-rays or blood tests usually needed?
So for typical acute bronchitis, the evidence actually suggests that routine diagnostic testing is not necessary.
Okay.
So unless there is a high suspicion for something like pneumonia, influenza, COVID-19, or pertussis tests are not generally recommended.
Okay.
Chest x-ray might be considered, if there are signs of what we call lung consolidation.
Okay.
So this is when there's fluid in the lungs instead of air,
Mm-hmm.
or if there are really severe symptoms or any of those red flag symptoms that we talked about,
Mm-hmm.
or in older patients who you might have a higher suspicion of pneumonia for.
Yeah.
So those are kind of the main times when you might consider doing a chest x-ray.
What about those viral tests that we hear about, like for flu or RSV or testing the sputum that you cough up?
So routine vital testing or sputum testing is not recommended for the vast majority of cases of acute bronchitis.
Okay.
So testing for influenza or COVID-19 should really only be done if it would change management. So if the patient would be eligible for antivirals.
Okay.
And then pertussis testing is usually reserved for cases where there's that characteristic whoop
Right.
followed by vomiting after coughing.
I've also heard about inflammatory markers in the blood, like CRP. Do those play a role in diagnosing bronchitis or helping doctors decide on treatment?
So routine testing for inflammatory markers like CRP or procalcitonin or a CBC or complete blood count is not recommended for diagnosing bronchitis or deciding on antibiotic use.
Okay.
However, there is some evidence to suggest that point-of-care CRP testing
Oh.
in patients presenting with acute respiratory infections might actually lead to less antibiotic prescriptions, which is really interesting.
Yeah.
But it doesn't actually make patients recover any faster.
Huh.
So that's something to consider, and the evidence for procalcitonin being used for this is still a bit unclear.
Okay.
And then as far as CBC goes, it's not very helpful because a lot of patients, even without pneumonia, can have a high white blood cell count
Okay.
when they have a lower respiratory infection.
Okay, so it sounds like diagnosis is mostly based on the doctor's clinical judgment, and then testing is really reserved for when there's a reason to suspect more than just typical bronchitis.
Right.
Now let's get to the part everyone wants to know, the treatment.
Yeah.
What actually works and what's maybe a waste of time or could even be harmful?
Yeah, so this is where the evidence is very helpful.
Okay.
Because the review really emphasizes that acute bronchitis is typically a self-limiting illness, meaning it will get better on its own.
Okay.
And on average, it lasts about 2 to 3 weeks.
Okay.
And a study from 2024 that they cited found that the average duration was 16.4 days,
Wow.
with 90% recovery
Yeah.
within 28 days. So that's important to keep in mind. So management should really be focused on symptom relief
Okay.
and patient education.
So manage the symptoms, let it run its course, but what about all those over-the-counter cough syrups and things like that? Do those actually provide any benefit?
So this might surprise you, but the evidence doesn't really support the use of cough suppressants or honey or antihistamines or anticholinergics, oral NSAIDs, or inhaled or oral corticosteroids for acute bronchitis.
Wow, that's a lot of stuff that people use.
It is. Yeah, so that's really important for people to know.
So what about the big one, antibiotics?
Yeah.
I mean, we already know it's usually viral, but so many people get prescribed antibiotics for a cough. What does the research say?
The research is pretty clear on this. Antibiotics do not significantly improve acute bronchitis.
Okay.
At best, they might reduce cough duration by a very small amount, like around half a day.
Okay.
But when you weigh that very small potential benefit against the potential risks, it's really not worth it.
And what are those potential risks?
So the risks include antibiotic-related side effects, like nausea, vomiting, diarrhea.
Oh, yeah, of course.
But even more importantly, contributing to antibiotic resistance.
Right. Yeah, that's a huge problem.
It's a really big deal. And also, we're medicalizing a condition that would probably resolve on its own.
Right.
And they actually cited a Cochrane review from 2017
Okay.
that found that antibiotics only minimally reduced cough duration, and they increased the risk of adverse effects. And there was no difference in overall improvement as reported by clinicians.
Okay.
It's a pretty clear evidence there.
Yeah. Wow, that's really interesting. What about inhalers like beta-2 agonists? Are they ever helpful?
So beta-2 agonists, which are used for things like asthma and COPD, can be helpful in the setting of acute bronchitis.
Okay.
Only if the person has asthma or COPD and they're showing signs of airflow restriction, like wheezing.
Okay.
But for people without those conditions, they're not recommended.
Got it. So it's really targeted use for people with those existing conditions. Since we know antibiotics are often prescribed unnecessarily for acute bronchitis, are there any strategies to reduce this overuse?
Yeah, the review actually highlights a couple of strategies.
Okay.
So one is delayed prescribing.
Okay, so that's where they give you the prescription but tell you not to fill it unless your symptoms get worse or don't get better.
Exactly.
Okay.
That can help reduce antibiotic use without negatively impacting patient safety or satisfaction.
Okay.
Another strategy is just describing acute bronchitis as a chest cold.
Okay.
And that can help patients understand that it's going to last a while.
Yeah, set realistic expectations.
Exactly, and reduce requests for antibiotics, and then just educating patients about the expected duration, which is 2 to 3 weeks,
Okay.
can also be helpful.
Yeah, that makes sense.
Yeah.
What about other things that people try, like herbal remedies? I know the review mentions complementary medicine.
Yeah, they do mention that, and they say that it's used in some countries for acute bronchitis.
Okay.
But the quality of the evidence supporting its use is pretty low.
Mm.
And one of the most studied herbal remedies is Pelargonium sideroids.
Okay.
And the Cochrane review actually looked at that
Okay.
and found that while it might reduce symptom severity, the quality of the evidence is low.
Okay.
So we need more research there.
Okay, so not a lot of strong scientific evidence there. What about just things we can do at home to make ourselves feel better?
Yes, so the review actually suggests several helpful lifestyle and behavioral interventions.
Okay.
So things like rest,
Okay.
hydration,
Of course.
humidified air,
Mm-hmm.
a cool mist humidifier, taking steamy showers, and then nasal saline irrigation can help with that nasal congestion.
Yeah, that all makes sense.
Yep.
Those are all good comfort measures.
Yeah, exactly.
And we talked about when pneumonia might be a concern, but when should someone with bronchitis think about getting further help?
So you should consider getting further medical evaluation if your symptoms persist or worsen beyond 3 to 4 weeks. And it's important to note that taking antibiotics for acute bronchitis doesn't actually reduce your risk of future healthcare use for this.
Okay, so it doesn't prevent you from getting it again or from getting a cold or the flu or anything like that?
Right, exactly.
Okay.
It just kind of makes you feel worse in the short term.
So let's summarize. What are the key takeaways from this deep dive into acute bronchitis that you should remember?
So the main points are that acute bronchitis is super common.
Okay.
In the vast majority of cases, it's caused by a virus.
Mm-hmm.
And because of that, antibiotics aren't usually helpful,
Okay.
and they come with some potential risks. So the best approach is to focus on symptom relief with those supportive measures that we talked about.
Right.
And just understand that cough can last a couple of weeks.
Yeah, so hopefully knowing all this will make you feel a little bit better next time you're dealing with this.
Yeah, and maybe you'll even feel a little bit more empowered to talk to your doctor about it
Absolutely.
and understand what the best approach is.
And it also helps to combat antibiotic resistance.
Yeah. That's a really good point,
Yeah.
because the more we use antibiotics unnecessarily, the less effective they become
Exactly.
for everybody.
And that brings us to our final thought for you to think about.
Okay.
Considering how often a cough sends people to the doctor and the human desire for a quick fix, what are the wider implications of understanding when less medical intervention is actually the best approach?
That's a really good question.
Think about your own experiences with coughs and colds
Yeah.
in light of this new information, and thanks for joining us for this deep dive.
Thanks for having me.
We'll see you next time.
Bye.